So I'm so excited to introduce Stacy with you guys because she has a story similar to mine, but it's just so nice to hear it from other people where their knee is just kind of getting a little bit more degenerative as we get older because we played sports growing up and in college. And so, like her, she was like, I don't want to have a knee replacement. I want to do everything I possibly can do. And so she did shockwave therapy, and you're going to hear her experience with shockwave and how much better her knee feels. So tell us a little bit about your knee pain. Yeah, kind of what the doctor said, what you did. Like, give us a little bit of history.
Okay, well, I have a history of playing a ton of soccer, as you know, and also running. I loved running. I run marathons, a lot of half marathons, and I just love to be active, lifting, CrossFit, all the things. And I started to get really sharp pain in my knee in 2017. They told me maybe it's a meniscus tear. They went in, found a bunch of arthritis for just a scope, which now, knowing what I know, I would not have done. I needed my Stephanie there, but they said that, well, really what they found was no tear and just a lot of arthritis. So basically, go home, get a rocker, stop exercising, stop lifting, stop running. Maybe you can swim. I just thought, oh my gosh, this is so different from my life. And they told me that my knee looks about 20 years older than it is, and that I would need a knee replacement within about 10 years.
Yeah.
So, fast forward these 8 years now, I have been able to do a lot of activity. I did not listen to them, but I cannot do the jogging. I cannot lift heavy, which is fine with me. And I was still dealing with a lot of pain. We're a hiking family, and I was dealing with a lot of pain. And I have a prior fitness background with personal training, and I have a lot of clients that have had knee replacements, and not one of them has worked out well, where they said, oh gosh, I'm so glad I had that done. So, in my mind, I wanted to make sure to avoid every chance of having a knee replacement, or at least put it off as long as possible. And that's where I started looking at different things in terms of what to do, and then talking with you. And one of the things that I have found along the way that makes so much sense. So when you told me about Shockwave, it made so much sense because I have noticed in these 8 years, the more active I am doing the right things. Now, obviously not overloading it. I can't go run you know, a marathon or half marathon or anything. But the more active I am, the better my knee feels. And it made me feel like there was connected to blood flow,
Hmm.
because I would notice that in periods of a lot less activity, getting busy with work and so on, that my knee would get sore more easily.
Yeah.
And and it made complete sense when I was talking with you about just trying to avoid swelling in my knee, and how options that I would have for it to feel better without surgery. Because in my mind, surgery is not going to make it feel better. I'm going to end up with a worse situation, a worse knee, and I'm going to be more debilitated than I ever was before.
Yeah.
And so that's why I was very open to shock therapy, or the shockwave therapy, but it makes sense to me because of what I felt, that the activity feel makes it feel better.
Yeah. And the problem is like when you start getting more degenerative tissue, which I mean, let's face it, we've abused our body. And
Yeah.
we both love to be active, and we're not going to slow down. Like I'm not going to slow down. So I'm going to find every way that I can to stay active and not have surgery. Your tissue becomes a little bit more degenerative, and it's harder to do heavier strengthening stuff that we know would help the knee joint because you can't get that muscle to fire. Because when you have degenerative tissue, you have a lack of blood flow in those areas. So you can't, so it's like you're just pulling the tissue because it's not like young with a lot of blood flow that helps bring all the nutrients and everything to make it activate. So for me, it was the kind of the same thing. I was like, oh my God, this is a no-brainer. This makes total sense. It's going to revascularize that area. It's going to knock out any kind of scarring that's happened from an injury or anything. And then the focus, just like putting the blood flow back into the bone. Oh, game changer.
Yeah, that's exactly what I felt. And since the therapy, I have really noticed that generally my knee feels very good, even when I have a period of less activity. We got very busy with recent things that have been going on in life, and a couple of weeks where normally I know I pay a lot of attention to my body. I know that my knee would have been very sore. Well, one of my knees was my right knee. I got my left knee treated, and it was a big difference because I could tell hands down, I know that that's the therapy that helped, let alone when I am active, I'm not having I'm having little to no soreness. Now, I don't know how that will be. Our family is going to end up doing several 15-mile hikes this summer, and I don't know how that will feel, but historically, before, by the time I would get to, you know, if it's 7 miles up and 7 miles down, by the time I'm getting to mile 4, I'm in pain on the way down, especially even with hiking poles. And the hiking we have done 5, 6 miles so far, so split the up, the down, I've not had that pain. That's a big difference to me. I mean, it literally is giving me a lot of hope and comfort, literal comfort
And
physically,
time with your family. I
and
mean,
time
because
with
your
my
family is
family.
very active. So that's like super important.
It is, and I don't want to miss this time with my kids while they're still home with us, and they're so motivated to go do this stuff. I don't want to watch my husband and kids go, "Oh, bye, see you when you get back." I want to do everything I can. So I'm looking forward to getting my right knee treated when in the fall.
Yeah. So what were some of your fears if this didn't get solved? Because I know, like, gosh, I can tell you of the people that we played soccer with at SMU, three of them already have had total knee replacements. Three, and they're in their 50s. And I know for me, that's not something I wanted to do, but what would have been your fears if this didn't get solved?
Right. I mean, I'm past 52, 50 as well. And uh, lack of complete mobility is my
Yeah.
ultimate fear, is not being able to move and go and do. My husband and I have always had a lifestyle where we have been active together. One of our favorite ways to spend time, from just simple walks to hiking to lifting and going to the gym together. So that was probably my biggest fear, is my family time suffering
Yeah.
because of my knee degenerating. And that's hands down. And also my other fears, I don't want to have a knee replacement. I truly, in 15 years of personal training with clients, I don't even know how many had knee replacements. I mean, I definitely over 30 that I worked with, not one of them had a better situation after their knee replacement. I mean, maybe with just being able to walk if it had gotten that bad, but
Yeah.
it it from a long time I have not wanted to have that type of procedure.
Yeah, no, I'm right there with you. And 50 is way too early to even be considering anything like this.
Yes.
So, yeah, just hearing yeah, I don't, I'm shocked at the amount of people that are having total knee replacements in their 50s.
Yes, I think it's a complete lack of education on the part of some of the practitioners that are pushing some of these procedures. And unfortunately, I just encourage anybody who talks with me about it, just make sure you get multiple opinions, and make sure you speak with physical therapists, because they have just a different approach
Yep.
than a surgeon is going to have. And it doesn't mean the surgeon has bad intentions at all. They're trying to fix a problem, I'm sure.
They are. And
But
the only thing they know how to do is surgery and
yeah,
medications and injections. Like they don't really have any other options for you other
right.
than say, go see physical therapist, go see someone. And hopefully it's someone that's going to be good because there's many that aren't that are out there.
Right.
And then you get frustrated that, oh my gosh, this is not really working and it worked for other people. But really finding someone that's good is key. Because once you have them, man, you have them in your back pocket. We have people that call us from like California, like, wow, this is what's going on. Give me your opinion.
Yes, absolutely. They're operating within their scope of practice. And I think what a lot of people don't understand, who are not in that world or not in the physical therapy world, or who have not had a good physical therapist, is they don't understand that the scope of practice and the expertise of physical therapy has a totally different approach,
Yeah.
with a good physical therapist. And that's what I've been so happy with Empower and your approach to therapy there, because even the exercises that you gave me to do in preparing and strengthening, I'm still doing those.
Yep.
And I have seen a big improvement. And I've even applied some of those to the other knee so
Yes.
that I can build it up before I come back and get more therapy.
Yeah. No, and the small muscles are so key. You don't realize like even a little small imbalances. Like if people are doing more quad control things and they can't get their glutes to fire, that affects the knee because you got to think of like, well, where's the pressure on the knee? Well, it's going to be more on the front versus more balanced in between. And so having just imbalances of like weakness can affect the knee. So it's important. Like the shockwave is going to make it feel amazing, but if you don't have strength in that as well, after the shockwave, it doesn't give you as good of a benefit. So it's really important to really have both.
Mhm.
So if you have someone that's on the fence about coming in and seeing us or trying shockwave, what would you say?
Oh my goodness, do it. And because there's so much potential gain and so little to lose. I mean, I being cut open and having your joint completely pulled out and having another one put in, that is a major, major procedure, and so many things can go wrong. And versus spending some money on Shockwave and seeing how much it could benefit you. There's little to no downside. And that's exactly what my husband said to me because as a family, we're very cost sensitive. And we looked at the cost and of course I trust you, but I look at the cost and I'm like, wow, okay, I'm going to spend some money here. And without even a split second thought, Justin said, oh my gosh, you have to do it. There is absolutely nothing to lose. If this could benefit you, I mean, we're talking about comparing this small bit, really, in the grand scheme of things, for
Yep.
me enjoying time with my family, this small bit of money versus this other potential future of having my whole joint replaced. That's so extreme that I just feel it is a no-brainer.
Yep.
People need to try the shockwave therapy. It,
Well, and
it
just the fact of like you can walk 7 miles and it's no big deal, and you don't even have the soreness. Like that alone,
absolutely.
like when you hurt and you're doing activities, you're not really thinking about your family. You're just like, how can I make it to the end? Like I
Yes.
am dying, and that's not enjoying your family. That's like the pain's taking over the joy.
Yes, and that's what my husband saw last summer because we did a 6 week trip as a family that was all national parks and hiking and he could see by some of the end of those hikes, as much as I didn't want to let it show, that I was in a lot of pain for the last couple miles. And he values that time with us for us as a family as well. And so I agreed with him very quickly and just said, we have nothing to lose. And that is absolutely why I will get my other knee done because I don't know why anyone wouldn't.
Yeah.
It's non-invasive and it just makes sense. Like I understand there's a lot of different things people promote out there, but this really makes sense when you look at the need for that additional blood flow to carry all the things to and
Yeah.
from the joint to help it work as well as it can, especially after years of abuse and us not knowing exactly how to treat our bodies. And it's it's fantastic.
Yeah. Well, thank you so much for your story because I know it's going to help someone else out there that is like struggling, that wants to stay active, that wants to have time with their family, that can't, and deciding like which direction should I go, and hopefully this will help them make a better decision to not have a surgery and to come in and have some life-changing therapy.
Oh, yes. And also, what we talked about too is this is peanuts. Like, this is an investment in my health. And this is peanuts compared to what would happen if we're going a surgical route. It's
Oh,
just,
yes.
that's why, and I know my husband would say the same thing because he sees all the progress. And he would say too, like, it is just a no-brainer. If you have a spouse or a friend that's considering this, encourage them to do it. I just told my neighbor about it this morning because I was like, you need to do it. Don't just believe that your only option is a knee replacement because
Yeah.
it's not true.
Yeah. or that you have to live with the pain and until it gets bad enough. I hear that all the time from patients too. When it gets bad enough, come back and see me and then we'll do surgery. And I'm like, seriously? Like sometimes I wonder these doctors, I'm like, let's give that advice back to you and see how you think. Like, how would you like that? Oh, sorry. Just like deal with the pain. And when it gets bad enough, come
Right,
do surgery. I don't
right.
think they would take that very lightly.
No, not at all.
I'm just like, you got to think of your advice that you'd give yourself. Okay, yeah, you probably wouldn't, but that's what we get all the time with the doctors. So, but
Yeah.
they don't have time and they're meant to look at like, okay, is this a surgical candidate or not? And that's not to say that all doctors are out there that are like that. There's definitely ones that are not, but from a lot of the people that come through our office, it's just eye-opening what we hear that their doctors tell them. So,
Yes. And when it was eye-opening to me too, because the doctor who did the scope on my knee in 2017, he just acted like it was such a flippant thing
yeah.
that, oh, just stop exercising and stop your normal life. And I was devastated, you
And he
know.
was an Olympic surgeon.
Yes, he and I
Which
just
is
kind of felt like, wow,
crazy.
I guess since I'm not an Olympic athlete, it doesn't really, it shouldn't bother me.
Yeah.
But this really bothers me. So
Thank you
I
so
just
much.
can't, I cannot encourage people enough. I am so thankful that you told me about it. I really feel like it's a complete gift. And there is no doubt in my mind that it's helping. And there's no doubt in my mind that I will do the other knee, which isn't as bad, but I want to do every single thing I can to feel
Yes.
better and to prolong feeling better.
Yes.
I don't know why anyone wouldn't.
I don't either. I'm the same way. I mean, I think partly it's just because we go in our medical system. It's like, well, that's just what happens as you get older, or you have arthritis and you feel like there's nothing out there for you, but there is. There's so much, there's new technology coming out all the time. And we're always researching it and figuring things out because we want you to stay active. It's possible. Like I just see my mom, she's 82 years old, and I'm like, dang, look what she's been able to do when she listens
Yeah.
to me and she does some of the things that I tell her. And I'm like, she's traveling all over the world and she's 82 years old. Like, no, that's what I want.
Yes, absolutely. And that's what I want for my 88-year-old dad who's still playing pickleball, who I am trying desperately to get him into your office because I'm trying to tell him it can be even better, dad,
It
because
can,
he
it
just
can.
loves being active.
Yeah,
So we'll keep working on him.
we will. We will. Well, thank you so much. Thanks for your story. I know it's going to help someone.
Hope so.